Hi, my name is Megan. I'm going to be your nurse practitioner today, and I will be performing an abdominal assessment on you. The first thing that I'm going to do is, with using the diaphragm of my stethoscope, I'm going to auscultate in all four quadrants. And I'll start up in the right upper quadrant, move over to the left upper quadrant, down to the left lower quadrant, and over to the right lower quadrant. And if I listen for 5 minutes and do not hear any bowel sounds, then that would be indicative of hypoactive bowel sounds. So moving forward, I'm going to utilize the bell of my stethoscope, and I am going to auscultate the abdominal aorta, which is located above the umbilicus, over to the side a bit. You can oftentimes feel the pulsation. I'm listening to hear if I hear any bruise, which I do not. So then I'm going to move on to auscultating the renal arteries. Those are located about at the same level, but mid-clavicular line bilaterally. So I'll listen over on the right side, and then over on the left side. And again, no bruise. So I'm going to move on to percussion, and the percussion is going to help me identify where the organs are and if there's any obstructions or masses there. So I'm going to utilize my left middle finger and my right pointer finger, and I'm going to percuss in all four quadrants to start off, just to get a general feel and idea. Then after I do that, I'm going to move on to percussing for specific organs. So I'm going to percuss for the liver, and I'll do that over on the right side. I'll start up here in the 5th intercostal space, and I'm going to work my way down, and I'm hearing dullness over the organ, but as I keep going, around the 10th intercostal space, it starts to turn to tympany, and that's how I know that that's where the liver ends. And then I'm going to do that on the other side to find the spleen, which is located around the 4th intercostal space, but it's more behind the ribs, so it can be a little more difficult to percuss. However, if the spleen were to be enlarged, you might have better access to it. Okay, now I'm going to move on to palpation, and for that I'm going to start with light palpation. I'm going to again do all my 4 quadrants, start in the right, over the left, down and over, and I'm just feeling if I feel any lumps, bumps, anything abnormal. Then I'm going to move on to deep palpation, and with the deep palpation I'm actually going to be able to feel the organs, so I'm going to go ahead and try to feel for the liver again. So I'll look in those same areas, and right at that right 5th intercostal space, mid-clavicular, moving around, and can feel that for the sake of my patient, I'm not going to actually deeply palpate. And then moving over to the spleen and trying to palpate for that, which is important if you were to feel, an enlarged spleen. Okay, so then I'm going to move on to assessing the appendix. And so to assess the appendix, I'm going to first assess for rebound tenderness. So I'm going to place my hand on the right lower quadrant, and I'm going to push down. And as I raise my hand, I want the patient to tell me if they have pain or not. So pushing down, releasing. If the patient were to have appendicitis, they would actually feel pain upon the release of my hand. However, she does not, so unfortunately. And then I'm going to move on to some of the other tests for appendicitis. So I'm going to do the psoas maneuver. So in order to do that, I'm going to place my hand right about in right lower quadrant here, a little lower, and then I'm going to have her lift her leg just from her hip. And that is going to put pressure on the appendix. That's great, you can relax. And if it did and she had something appendicitis, it would be very painful. And then another test that you can run is the obturator. And in order to do that is you have the patient bend their knee, and you're going to inwardly rotate it. And again, that's putting pressure on the appendix, so then that will help determine, if there's appendicitis. So I'm going to move on to palpating for the abdominal aorta. So I'll go back to where I was listening prior, which is above the belly button, a little bit over. I can feel that pulsation. And I'm just feeling around. If it were hard, that would be concerning, and I would need to further look into that. But fortunately, it feels normal. And then I'm going to move on to assessing for her kidneys. So I'm going to have you go ahead and sit up, and I'm going to do this by first just percussing to hear them. Sound okay? Some light palpation, and then I'm going to move on to assessing for CVA tenderness. So I'm going to do that by taking my left hand into a fist, putting it right in her flank space, and my right hand, and I will just kind of hit it with that hand. And I'm looking to see how my patient reacts and if they're experiencing any pain. All right, thank you.